Hello, wonderful people. Welcome to my channel. And if I may ask, have you observed whenever you go to the hospital, no matter the case you brought, you have to pass through a certain routine? We call it vitals. And today we are going to talk about one of them, which is your BP. That's your blood pressure. So today's topic is arterial hypertension. For you to understand what at all is hypertension, we are all having hearts which is working for us, is working every day. And what's happening is, whilst it is working, it has to rest within. So contracting, whilst the heart is contracting, we call it systolic. And if you can read, when you go to the hospital and we check your BP, we normally write figures. We write at the top and we put slash and we write figure added down. And both of them, the top is whilst the heart was contracting and the down is whilst the heart was resting, and both should be in a normal range. At the top we call it systolic. It should always not be more than 120, and at the down we call it diastolic. In terms of relaxation of the heart, it shouldn't be more than 80. So in a situation where when we check your blood pressure and those figures, there is changes, there are increments more than what I said, it shouldn't be that, let's say, continuously. In a situation there can be changes depending on what was going on. Maybe you were in rush, or you are emotionally, you are going through something, or you've stressed up. All can cause changes in those value. But in a situation where you believe that, or you can be sincere to yourself that you are not doing anything, you are at peace, you are resting, and we check, and always through your resting, systolic and diastolic, or it can even be only the top, there is always changes, only the down, there is always changes, then we can classify you as you having hypertension. About causes of hypertension, first of all, we have to know the type of hypertension. We have two types. First, the primary or the essential type of hypertension, and we have the secondary type of hypertension. And about 95% of people suffering from hypertension is caused by the primary or the essential type. And it's quite unfortunate that that primary type, we can't identify, or we can't pinpoint that this is the cause of your hypertension. And that of the secondary, it can be as a result of suffering from different disease. It can be that you are suffering from kidney that is causing your hypertension, or it can even be there is endocrine disorders. You are having, let's say, hyperthyroidism, or you are taking in medications like oral contraceptives, which is causing your BP to increase, or as a result of taking in much salt, that is causing increments of your BP. But we can also talk about people having high risk of having hypertension, those having cardiovascular risk, example like age. As you are growing, you get susceptible to many diseases, and hypertension can be one as you growing. And we can talk about people who do not exercise, so physical inactivity can also cause high blood pressure. We can talk about increments in your cholesterol level. If you have high cholesterol level, you can have hypertension. And people who smoke, you increase your chance of having hypertension. And those who take in much alcohol, people who are diabetic mellitus, or having sugar diseases and all that prevascular diseases, you have high risk of having. And obesity, if you are obese, you have high risk of having hypertension. Family history can also increase your chances of having hypertension depending on the kind of history you have. We can talk about some of the pregnant women, although they weren't hypertension patients, but due to pregnancy from their 20th weeks, they get exposed to hypertension. And depending on the associating symptoms, we will then classify them under preeclampsia or eclampsia if there is seizures in addition to all the symptoms. We can talk about salt intake. If you take in too much salt, you will increase your chances of having hypertension because there will be retention of water, which will increase your volume of blood, and there will be hypertension. This reminds me, when I was a child, I used to convince my grandmom to take in salt because the food is not tasty. I want to join her to eat her food, and my grandmom would say, doctor says I shouldn't eat salt, and I would tell her, put small in. Doctor is not here, how will he know that you kept salt in? It's true, doctor won't see, but doctor will notice when you get to the hospital. There will be no improvement of your BP. And let me remind you, if you add even 2 millimeters of mercury, like if your BP is 120 or 130 or 140, and you didn't help to reduce it to normal, and you add up even 2 millimeters to the value, you expose yourself to complications. You can have stroke at that moment. It can cause heart attack, all kind of diseases. You can cause target organs damage, and you have to make sure you won't cause such. Take my adulthood advice, don't take my childhood advice, and see you next week.